Welcome back to another Dr. Evidentia explainer. I am absolutely thrilled you're here today. If you're new, this is where we take a magnifying glass to complex medical research and translate it into clear, actionable health insights that you can actually use in your everyday life. Today, we're going to look at the data, break down the science, and figure out exactly what it means for you.
Real quick before we get into the nitty-gritty, a standard but super important reminder. This explainer is strictly for educational purposes. You know the drill, always consult your own primary care doc or a registered dietitian before making any major changes to your diet or lifestyle. Every single body is unique, so personalized medical advice is absolutely key. All right, let's get right into it. Today, we're tackling a massive question based on a landmark 2024 study published in the Lancet Planetary Health. Are you ready for this? We're looking at whether the exact same diet that fights climate change can also powerfully protect you from heart disease. It sounds like a total pipe dream, right? Two birds, one stone. But wait until you see this clinical data. It is absolutely fascinating. Let's set the stage by looking at the two-front health crisis facing both the Earth and the human heart. Understanding this baseline is crucial for seeing why this research matters so much. Think of the planet as our first patient. Our modern global food system is in a severe crisis. To put it in perspective, our current agricultural practices generate roughly 26% of all human-made greenhouse gas emissions. And it doesn't stop there. Food production gobbles up a staggering 40% of global land and 70% of all freshwater use. The way we're currently eating is literally altering the Earth's biophysical equilibrium. And at the exact same time, our second patient, us, human health, is facing a parallel crisis. Cardiovascular disease is still the undisputed leading cause of death, both here in the US and globally. And the major driver? You guessed it. Poor diet serves as a leading behavioral risk factor for heart disease worldwide. We're essentially eating ourselves and our planet sick. Enter the planetary diet. To treat this dual crisis, a group of experts known as the EAT Lancet Commission came up with a very specific dual prescription back in 2019. So what does this actually look like on your dinner plate? The planetary health diet leans heavily into plant-forward foods. We're talking a big push for whole grains, veggies, and unsaturated fats. On the flip side, it puts some pretty strict caps on red meat, dairy, and added sugar. Just to give you an idea, the ideal target for red meat is a mere 14 grams a day. For reference, that is essentially the size of a single meatball. Now, to measure how well folks in the real world actually stick to this strict plan, researchers built a specific clinical tool called the Planetary Health Diet Index, or PHDI. It's a scoring system that ranges from 0 to 140. The takeaway here is simple. A higher score means you're eating much closer to these ideal targets for humans and the planet, while a lower score means your diet is heavily reliant on meats, sugars, and refined carbs. Before we look at the study results, I'm really curious to hear from you. Honestly, could you realistically cut your red meat down to just one meatball a day? Or would giving up added sugar be the real challenge for you? Drop down into the comments and let me know which food group would be the absolute hardest for you to change. Moving on to the clinical data. To prove if this planetary diet actually works for human health, we have to look at the hard evidence from this 2024 Lancet study. And when I say mega study, I mean it. This explainer is breaking down a truly monumental medical investigation. Researchers started tracking people all the way back in the late 80s and early 90s, and they kept following up with them for decades until 2017, culminating in this massive 2024 publication. In the world of nutritional epidemiology, this kind of long-term tracking is the absolute gold standard. The sheer scale of this research is mind-blowing. They tracked nearly 200,000 male and female health professionals across 3 major cohorts. The crucial part? Every single participant was completely free of heart disease, cancer, and diabetes at the start line. Plus, they didn't just ask them what they ate once and forget about it. They meticulously updated their dietary scores using detailed questionnaires every 4 years for 3 whole decades. Okay, a quick translation before we hit the data. You're going to hear the clinical term hazard ratio. Think of a hazard ratio of 1.0 as your absolute baseline risk. If a diet gives you a hazard ratio below 1.0, let's say 0.80, that simply means a reduced risk of a disease occurring compared to the baseline group. It's exactly how we clinicians measure if an intervention actually protected the patient. All right, the moment of truth. Let's reveal the heart health results and see what happened after tracking these healthcare workers for a staggering 4.5 million person years. The headline finding here is nothing short of remarkable. The data showed that people who ate closest to the planetary health diet, meaning they scored in the top 20%, had a 17% lower risk of developing overall cardiovascular disease compared to the folks who ate the least planetary-aligned diet. When you look directly at the multivariable adjusted data, the dose-response relationship is just beautiful. Check out that bottom row. As the diet scores move from the lowest group on the left, quintile 1, all the way to the highest in quintile 5, those hazard ratios steadily drop from 1.0 right down to 0.83. Basically, every single step closer to this diet noticeably improved their odds. To really drive this home, comparing that highest adherence group directly to the lowest makes the risk reduction incredibly stark. That adjusted hazard ratio of 0.83 tells us that even after the researchers accounted for things like age, physical activity, smoking, and family history, eating this way independently protected their cardiovascular systems. And when we drill down into specific conditions, the protective effect held incredibly strong across the board. That top group saw a 19% lower risk for coronary heart disease and a 14% lower risk for overall stroke, which explicitly included a significant drop in ischemic strokes. So this diet didn't just prevent one very specific type of heart issue, it provided broad, systemic vascular protection. Of course, as always, we have to look at these strengths and limitations. Weighing the evidence is what we do here, because no study is perfect, and true health literacy means understanding exactly what the data can and cannot tell us. Now, this study boasts some incredible strengths. A massive 30-year perspective timeline with repeated measurements that significantly reduce random error. But there are limitations to keep in mind. The dietary data was self-reported through questionnaires, which, always carries some room for measurement error. Also, the cohort was mostly white healthcare professionals. So while the underlying biology likely applies broadly, we absolutely need more diverse, global data to see if these exact percentages map perfectly across everyone. And that brings us to Dr. Evidentia's final prescription. What does all of this clinical data actually mean for your grocery list this week? The most concrete takeaway here is that eating a plant-forward diet rich in whole grains, vegetables, and unsaturated fats is not just an environmental choice. It is a scientifically proven strategy to protect your arteries as you age. By minimizing red meat and added sugars, you are simultaneously reducing global greenhouse gas emissions and directly lowering your own personal risk of a heart attack or stroke. Listen, if you want to keep making informed health decisions based on actual, robust clinical data, rather than whatever internet fad is trending this week, please give this explainer a like and hit that subscribe button to join our community. It really does help us keep bringing you these deep dives into the medical literature. Remember, our core mission here is helping people make informed health decisions through reliable evidence. But I want to leave you with a profound final thought today. If saving our own hearts requires the exact same dietary sacrifices as saving our planet, which of those two urgencies will finally be the one that changes how you eat? Thanks so much for joining me, and I will see you in the next explainer.